The U.S. Surgeon General is calling for a warning label on social media.
This is opening up a can. We could talk about this for hours. Dr. Willow Jenkins joins us now, pediatric psychologist at Rady Children's Hospital. Doctor, good morning. Thanks for being here.
Thank you for having me.
We could talk about this for hours, couldn't we?
Oh, I've been talking about it for days.
The first question for me would be, is it surprising that it's taken this long? Because I think we've known the ill effects, if you will, of social media on certain kids, the younger they are, or even middle school age. Was it surprising for you that it took this long?
In some ways, yes. I mean, in some ways, no, because one of the reasons that I think it's taken long is we don't have a lot of really good research that's been done, and part of that was one of the things that came up, Dr. Murthy talked about needing more of the data released for us to study it. So I can understand both sides, but I think it's time to talk about it.
Like what kind of data, what kind of research needs to be done? Because a lot of this happens when kids in middle school or elementary school or high school, they're sitting in their rooms, they're by themselves, they're looking at the phone, and somebody says something on a social media page and it gets them. They're not going to go and volunteer that information, so it seems like it's a difficult subject to research.
In some ways, yes, but I think the thing is that the social media companies have a ton of data available that hasn't been that we haven't been allowed to independently review or research. And so one of the calls is for those companies to release the data to allow us to study more and see, is it a certain type of content? Is it really the screen time that we talk about a lot, the amount of time? Are there certain children who are more at risk? So there's a lot of nuance that could be done that might help us tease out really specific recommendations.
When we talk about kids being affected, there was a day that we said, okay, no screen time, it's not good, but the reality is this is their world right now. We're moving in a digital world, so they need to be exposed to some of these things as well.
Yeah.
So how do we know the negative aspects of how they're being affected by this?
Well, I think it's really important as parents to look at your individual child. So like, what is your child's motivation for using? What are they getting out of it? What type of content are they using? Are they looking up history for their research project? Or are they looking at more harmful content about body image? So there is a lot of nuance. And then like the amount of time being used, is it taking away from other activities? Are they not doing other hobbies and sports because all they're doing is being on their device? So those are some of the questions you can ask your child individually to make that determination.
The Surgeon General's warning, if that were to happen, what would that really mean and what would that look like?
Well, these are good questions, and I think I have some of them too, because a warning label on a digital product, is that going to be like a pop-up screen? I'm not sure. I think the one thing I can see as a positive, though, is it can bring more awareness to parents. I mean, we're knowledgeable about this, but there are still some parents who aren't clear that social media does have negative effects, and we know that if parents are more restrictive with their children and screen use, then it does go down. So if parents have more awareness, it could be a positive.
Governor Newsom is also talking about these phones, is calling for a ban on these smartphones in the classroom. I thought they were not allowed to be used anyhow. No? Are they? I mean, you're technically not allowed to use them, but the kids are sneaking them in and then they're...
Well, I think the thing is a lot of schools deal with it differently, and there hasn't been like a unified way that schools have been dealing with it. So I think we can all agree, if you have a smartphone during class, you're not going to be focused on class. And it seems like a good idea.
True, but... in the small case of an emergency, small case of, I can see where those phones would be valuable to have.
Well, one thing I was looking at that was interesting is he does only call out smartphones. And so I was wondering if it meant that other types of phones might be okay. Because I had similar questions, like I have older patients who work and have jobs, and they might need to be called about a shift, you know, when we're talking about older teens. So you could see there could be some reasons for some exceptions and need to communicate, but it wasn't clearly outlined.
Okay.
I wanted to go back. You mentioned several times that this is very nuanced, obviously, and certain kids are affected differently, just like we all are. Different people are different people. How have you, in your work, seen firsthand how social media, how phones have affected kids in a negative way? Do they come to you with really deep problems, or is it just kind of, what are you seeing?
Yeah, well, I obviously see most of the negative effects because those are the patients I'm working with, so I always want to caveat it with that. But yes, I see a lot of issues where it's exacerbated depression, anxiety. If you already are depressed, you're likely to use social media in a negative way, body image issues. One of the things that comes up consistently is that children that struggle with self-control, like the children who have ADHD, really, really struggle with setting limits on screens and social media, so that can be a big conversation. So I do see the effect.
Yeah, and what about just the effect of their attention span? Like, we're now living in a day and age, like if the conversation is longer than like 7 or 8 seconds, this generation can't, the younger ones, can't tolerate it because everything is just so go, 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 go on social.
I know, and I think that's why it's so important to really try to limit, especially that short form type content. Like even getting a child not to sit for a normal television show can sometimes be a strain. And so looking at what we're using is so important.
Tried to get them to watch a Godzilla movie, and they're like, how long is it? It's like 2 hours long, but it's really good. They can't stay in the room for more than 3. It's like, oh my God, what are we doing here? I wish, you brought up that the parents need to be more aware of how these apps work and how, but most parents need to learn stuff and do stuff. I don't know how to do the TikToks, and it's a whole deal. Dr. Willow Jenkins, thank you very much. We appreciate it.
Thank you.
Keep up the good work.
Thanks.